Dis-Chem is among pharmacies who will be offering drive-through vaccine shots when they become available in South Africa. The company currently offers COVID-19 testing at 9 drive-through sites across Gauteng, the Western Cape and the Eastern Cape. Dis-Chem says it's currently engaging with government about the distribution procedure. To talk more on this, Dis-Chem Pharmacies Manager Lizeth Kruger. Lizeth, thank you very much for taking the time to speak to us. How are you coping at the moment with a great influx in both your swab testing and your rapid antibody testing?
Yeah, thank you. So we learned a lot in the first wave, which was in June, July. And due to that, we actually have a system that only allows a certain count of people to go for testing, so that we know that they can get their results out in not more than 2 days. We try to. Otherwise, you do just, a lot of lab tests and the results won't go out. The rapid is sometimes a challenge. The rapid antibody and rapid antigen test is sometimes a challenge due to the fact that the stock is so quickly out. So we do try to tell the customers and patients to first phone the specific Dis-Chem store before they go for the testing. But yes, we learned a lot, and it's a challenge, but we are managing still.
And how are you going to use this model to build on that, to offer vaccine jabs? And will you only be offering those at these 9 drive-through testing sites?
No, so definitely not. We will extend it to all the stores and to all the clinics. Vaccine immunization has been part of the Dis-Chem service offering in the clinic for the past 22 years. So all the stores and the clinics will definitely offer it once we've got it, and once the process has been in place for from the government side. And then the 9 drive-through site is just the extension, because the 9 drive-through site is at a Dis-Chem store. So it makes it easier then to extend that as well. We actually first started to say that we will extend the flu vaccine, so people don't have to go to a store if they don't want to, if they are, they've got comorbidities or they're over 60 and they want to keep that social distance. And we said, well, if we've got the vaccines of the COVID, then we will extend it to the drive-through sites as well for the same reason.
Lizeth, communication from government side has been scant. We understand the challenges that they've had to endure in the procurement process. Despite those challenges, we are still waiting to hear what kind of vaccine stocks will be available. We know there's a certain amount of the AstraZeneca doses that will be made available specifically to healthcare workers. Do you have any more information based on your engagements with government to put people's fears at bay? A lot of people are saying, well, they don't know what kind of vaccine they're going to get, so they will definitely not get the jab. How can you improve messaging to try and reduce vaccine hesitancy?
Yeah, well, I'm a big advocate for immunization overall. So what I can say to everybody in South Africa is that you must just understand that if a vaccine is registered in South Africa, you know that it's safe. You can take it without a blink. And like I said, I am an advocate for immunizations. And the COVID vaccine is not out of that big group of vaccines. So it must go through the registration process of SAPRA, which they are currently busy with. We know that. We do know that they are planning for the end of January to start with the phase 1 for the health workers, the frontline health workers. I think the South African population must just trust a bit. I know it's been a hectic year. I mean, it's been a hectic year for everybody, and the more in the health sector. But I do trust that they will definitely deliver in what they're saying. I do trust that the vaccine that they are going to start off with will definitely be sufficient. And at least they talk about 70%. 70% is for people not getting COVID. At least the other 30% is not getting into the hospital, at least. And that's what I can say. So trust a bit. I think we will get there.
And what challenges do you foresee with distribution and sort of giving these jabs in terms of storage? We know that's a problem with the Pfizer vaccine. What kind of things are you grappling with at the moment as you prepare?
Yeah. So what I can say also from what we learned is that The Pfizer vaccine, obviously, in South Africa, it will be a small volume. It's almost impossible to store a vaccine at -70 degrees. So, and the normal vaccine is, the oldest vaccines are stored between 2 and 8 degrees. And all the distribution, pharmaceutical distribution, and Dis-Chem obviously is part of that. We do have the facilities to store vaccines between 2 and 8 degrees. The specific process from the government has not been in place, but they do engage with the private sector. They understand that they need the private sector also to assist with the distribution of the vaccine. And like I said to everybody else in the media, that you must remember the COVID vaccine is not out of the group of the vaccines. It's between 2 and 8 degrees what they're looking at, the vaccine that they're going to purchase. And it's going to fall in the normal distribution process, and we believe that as well.
Lizette, will people be able to come and purchase or get a vaccine jab from you outside of the parameters of the schedule set up by the government? For instance, if I'm not a healthcare worker, but I have comorbidities, I want the jab first, will I be able to get one at Dis-Chem, or are you going to be very strictly held to the same timeline that government sets?
Yeah, you must remember, because we're in a crisis and because it's a pandemic, it must be highly managed, and every single person that gets the jab must be registered. So it will not at this stage be out of the government phase 1, 2 and 3. Obviously, they are focusing on the people that needs it first, that is vulnerable, and that obviously with like health workers, that we do need the health workers if you're sick. So that's why they put in the phase 1. Phase 2, obviously, the older people and the people with comorbidities. So no, at this stage, it won't be outside of those phases, and it must be highly regulated. I think everybody needs to understand that as well.
And in terms of payment for this jab, I know government is bandying about a lot of figures in terms of the cost to the country. What will the cost be to the man on the street?
We don't know yet, and we don't have a confirmed price yet.
So no information available on that yet, but thank you very much for laying out the basics of your rollout strategy. We have been speaking to Lizette Kruger from Dis-Chem.